The internet has brought some interesting new developments in the way that drug treatment is delivered in Europe today. Until recently, we have tended to think about drug treatment in terms of outpatient or inpatient services. Recently, a new way to engage people with a potential drug problem is the delivery of drug treatment over the internet. Internet-based drug treatments are automated and structured interventions delivered over the internet. They use tested psychosocial interventions such as cognitive behavioral therapies or relapse prevention and integrate them into a new web-based delivery mechanism.
The first step participants have to take is register and provide some basic data. This information can refer to their personal drug consumption, whether their goal is to stop or reduce use, and what measures they intend to take to achieve this goal. Once registered, participants work with virtual tools and navigate through the program on their own. The main module is generally a diary where everything related to the drug in the participant's daily life is recorded. This covers details such as times and situations in which an urge to use drugs occurred, the times the drug was actually used and the people that were around, and relevant feelings and thoughts. Interactive feedback is then generated by an algorithm based on the information entered by participants. Additionally, participants create a personal relapse prevention plan which identifies potentially difficult situations and provides tips on how to deal with them. Some programs also provide contact with other users via an integrated forum or a chat. The exchange in these virtual communities often has the effect of creating a virtual self-help group.
The idea behind internet-based drug treatment is actually very similar to that of face-to-face therapies. They aim to help participants to get a better insight into personal drug use, to develop coping strategies and to manage cravings. Also, they help to build motivation to stop or reduce drug use and to make lifestyle changes. Internet-based treatment for people who use illicit drugs is a recent development. This is why we don't yet have strong evidence of its effectiveness, although the number of studies is increasing. One concern is the lack of face-to-face interaction with a counselor, which might reduce engagement and lead to high dropout rates. However, internet-based drug treatment can also be a first contact with help and a way to motivate drug users to seek further professional support. Using the internet as a delivery mechanism for drug treatment is linked to data protection and security. This is clearly an issue service providers will need to continue to address. There are clear advantages of delivering drug treatment over the internet. Its cost is relatively low and it has global reach, in the sense that a large number of people can access it from anywhere, at any time. There is even a new term for the provision of health services over the internet. It's called e-health, and it's rapidly gaining importance how healthcare is being delivered in Europe today. In 2012, the European Commission endorsed an action plan on e-health entitled Innovative Healthcare for the 21st Century. In the future, we may see further technology-based innovations that impact drug treatment delivery. However, the forms they take and how widely they are adopted will remain to be seen.